Hi, this is Matt Kruse, and I'm reviewing case 6410. So this is a CT urogram study which has three parts. The first series listed would be a non-contrast CT. Second would be a post-IV contrast CT in the venous phase. And the third would be a delayed or excretory phase CT. So I'd say the non-contrast is most helpful to look for stones. We'd be looking for any renal stones or anything here in the collecting systems, possibly a tiny stone here on the right in the upper pool, looking for any stones along the ureters or within the bladder, anything to account for the patient's hematuria, which is typically the indication for this study. On the venous phase images, we're looking for any masses, typically any masses in the kidneys, along the ureters, or within the bladder. We see what looks like a nice simple cyst here in the lower pole on the left kidney, possibly some parapelvic cysts on the renal sinus on the left here. I don't see any renal masses in this patient. But if we scroll down to the bladder, here in the left anterior bladder, we see what looks like an enhancing or hyperdense mass that's sort of protruding in the lumen a little bit, and it has some adjacent wall thickening. So we can prove that this is actually enhancing tumor by measuring the density. Here, mean density 97, and comparing that to the pre-contrast, where it's sort of subtle but the mass is there. Pre-contrast density 37. So this is definite enhancement. It's definitely an enhancing tumor there. The delayed phase images sort of provide an outline of the whole renal excretory system. So the bladder will be typically filled with contrast and the patient's lying prone, so we can nicely see the tumor outlined with contrast in the bladder. The ureters are typically filled with contrast, as well as the renal collecting systems, looking for any filling defects or masses along the urinary tracts. Here we can see those were actually parapelvic cysts in the upper left kidney. So this is a case of enhancing left anterior bladder mass, and this was a urothelial carcinoma. That's all for this case. Thanks.